This morning, we're going to go through a rock drill, rehearsal concept. Before I start, I'm going to go through one more review. Any questions, comments on the district plan?
In hopes of supporting you, the Joint Interagency Task Force, in the preparation of a plan.
Next slide. It's going to be shipped out to those hubs in trays. Each one of those trays.
Over time, we have the redundancy or the analog version, which is what Sergeant Cruz just showed you, on the chain of custody form. Chain of custody form.
Good morning, Captain Mike Rice. I'll go through some of the requirements that are outlined here for each of the 5 ULCs. Out here at the loading dock as quickly as possible. What that does is it mitigates any risk of the drugs being dropped. They could be lost or simply tampered with or just left behind. So what we would do at this point is the team members, when we come up, we would ensure that the package is still intact and its integrity is fine. We would make sure that...
The other important thing to note is we can manually reduce the inventory. And you can only take it from what you've already inputted in the system. Click all these numbers.
As you can see, we have sealed the container that is going out for shipment. However, it needs to be further packaged. And what you're going to see is it is going to go to one of our packing boxes here. You're only going to put enough tape on a couple of sides, not completely around. And that's just to keep the lid from coming off, but still allows some of that gas to come off. That way we don't build too much pressure. About a tire on a vehicle or some unforeseen circumstance, the cargo would be safe.
I mean, I think that's a good point. And then the other piece, and I'm not sure we would have to look at numbers, is if we have a location that is getting multiple of these, how we want to do a chain of custody. Do we want to do a chain of custody?
David Reynolds, David D-A-V-I-D, Reynolds R-E-Y-N-O-L-D-S. I'm the ADIC, Army Air Agency Training Education Center Battalion Commander. And for this exercise, I'm the Operations Chief for the JITF, the Joint Interagency Task Force.
And could you tell me the drill, where we are today and the drill we are executing today, sir?
So we're here at JFHQ, the Joint Force Headquarters in Charleston, West Virginia, preparing to deliver the rehearsal of the concept for the Joint Interagency Task Force in preparation for receipt and delivery of the COVID-19 vaccination.
And could you talk to me about what is to be expected of this rock drill and some of the agencies that will be involved with it?
Integration is key to success for the delivery of the COVID-19 vaccination. It's essential that the agencies that are involved or that have equities in the delivery of the COVID-19 vaccination have the opportunity to rehearse and to discuss and coordinate with their interagency partners prior to receipt of the COVID-19 vaccination so that we are prepared to efficiently deliver the vaccination in a timely manner and develop a thorough plan that ensures that the vaccinations are utilized as outlined in the priorities that was discussed and approved by the interagency partners in prior meetings.
And last thing, sir, if you could talk to me a bit about how, we've been on COVID orders for so long, sir. We've been doing all this work regarding COVID-19, and for something like this with a drill involving the vaccine, it just seems like a culmination of a lot of different task force and the Air Guard and the Army Guard coming to this big event. Can you talk to me a bit about that culmination, sir?
The joint staff as a whole, as well as the West Virginia Army National Guard, has done tremendous work over the last several months, put in an enormous amount of time to support the testing for the COVID-19 vaccine. Now with the transition to the vaccine distribution, this is an added requirement that the West Virginia National Guard has stepped up to meet. They are dedicated and integrated with their interagency partners, so we feel confident that we will successfully execute not only phase 1 but the following phases of the COVID-19 vaccination distribution plan to both protect and to care for the personnel of the state, or the citizens of West Virginia.
Kyle Frazier, K-Y-L-E-F-R-A-Z-I-E-R, Task Force Vaccine. I guess it'd be like Region 5, Lewisburg.
And what about your traditional M-Day unit, sir?
Oh, my traditional is I'm with the 601st, 3rd Platoon Leader.
And talk to me a bit about the VAM system that you are using, sir.
So the VAM system right here, you know, just on your computer, nothing too crazy. What it is a system to track the vaccines, all different types that we will receive in the future, whether or not, like where they go in the state to which region they go to. We will be using it along with our civilian counterparts to track the lot numbers of all the vaccines that we receive within the state. What it is it's our method of checks and balances to see who receives what and when they receive them, whether they put in the request, and we issue those requests out to like send it to the hospitals, the pharmacies, and all the other locations like health departments. So that's the big gist of it. It does have some other things like your jurisdictions. We can see like who all is getting what. But for me, at my level, I will just be working within the Greenbrier region.
My name is Marty Wright, M-A-R-T-Y, W-R-I-G-H-T. I'm the CEO of the West Virginia Healthcare Association.
And could you talk to me a bit about your involvement with the exercise today?
Well, with the prioritization of long-term care, that being the nursing homes and assisted livings, to receive the early shipments of the vaccine, we've been heavily involved with the task force to try to make sure we facilitate that distribution to our nursing homes and assisted living statewide.
You're at the, so you're involved with the Sundale Nursing Home, sir?
Yeah, so one of the nursing homes that was the first to be impacted was Sundale Nursing Home. The plan that is ongoing right now is to, with the limited doses that come in week 1, to distribute them statewide with an anticipation that week 2 and week 3 we'll be able to hopefully complete distribution to all nursing homes and assisted livings before the end of the year.
And could you talk to me a bit about kind of like the whole idea that's coming full circle, because I was actually the one who did the video for the Sundale home, and it's kind of interesting to go from that point, you know, ground zero to here we are pushing out a vaccine.
Sure. So the first nursing home that was impacted by the COVID virus was the Sundale Nursing Home up in Morgantown. With the first distributions going out to nursing home assisted livings, Sundale will also be one of the first or among the first to receive the vaccine for it. So we've been able to achieve a situation in which you had a situation where the first nursing home that had impacted will very well maybe one among the first to get the vaccine.
That's awesome. And if you could just talk to me a bit about the joint effort that's been happening here today between the National Guard and the other agencies in West Virginia.
This has been a multi-month process that's finally coming to fruition. I know there's been a lot of planning, and over the past several weeks, they've really seen all those pieces come together. It's very impressive to see what's going on. The complexity of the distribution is hard to fathom until you actually get in here and see all the people involved and how long your piece works. But it's absolutely been impressive to see how this is going to work, and I have every confidence that we're going to have a very good distribution plan to get everyone a vaccine that needs it.
My name is James Stenek, J-A-M-E-S-S-T-E-N-A-C-K. Currently, I'm our acting chief nursing officer at the 167th Aeromedical Evacuation Squadron, stationed down here at the 130th Airlift.
And tell me a bit about what we're doing today, sir.
So today we're going to be giving a briefing on how the whole distribution of the vaccine is going to be taking place, such as how are we going to be receiving the vaccines at our ULCs, how we're going to be distributing those vaccines, and then all the behind the scenes tracking and logistics aspects that go into making sure that the vaccines are distributed appropriately.
Can you talk to me a bit about how these distribution points are being executed?
So the distribution points are being executed across multiple areas of the state. Each distribution location will have a number of vaccines that are delivered to them. At that point in time, they will be placed into cold storage. We'll be waiting on our working orders to come in. Once those working orders come in, we will then go ahead and start to fill those orders for those using activities, and they will then be funneled out to smaller entities in the state.
And if you could talk to me a bit about the culmination of all this work with both the Army Guard and the Air Guard and the different agencies that will be here today.
Sure. It definitely is a lot to take in when it comes to joint operations. Having the multiple agencies, both the Air, the Army, and then like you were talking about, our outside agencies. Everybody has been working diligently for the past year on COVID orders. Many of them have been working in these seats here, preparing for this moment for almost a year. And it looks like we're going to be on the orders here a lot longer to make sure that this distribution happens.
Is there anything that you would like to add, sir, or maybe something that we're missing that the general public would like to know, or?
I think probably the biggest thing is all the hard work that's going in behind making sure that this vaccine is being distributed appropriately and it's able to make it to the individual. Also while ensuring to them that it's a safe vaccine that can be taken. This way we can help stop the spread of COVID.
All right, and I'll close out there, sir.